Yeah, welcome everyone, and thank you all for attending our virtual panel exploring masculinity, men's mental health, and relationships. And before we begin, I'd just like to acknowledge that I'm hosting this event today on the traditional, ancestral, and unceded territory of the Musqueam people. Many of us work and study and live on this land. And I'd also like to acknowledge that due to the virtual nature of this panel, others here today may be on different territories. And if you're interested, you can feel free to visit native-land.ca to discover where you reside. And just going through some rules for the viewers, please mute your microphones during the panel and save your questions for the Q&A session at the end. And we'll have maybe around 30 minutes to answer your questions, but feel free to put them in the chat and we'll address them at the end. This event is hosted by the UBC Reducing Male Suicide Cluster and SVPRO Okanagan Healthy Masculinities. The Reducing Male Suicide RMS Cluster is a research excellence cluster with 13 members from various institutions, and it is aimed to address men's mental health inequities, optimize men's mental health help-seeking experiences, and equip community-based and professional mental health care services to expertly evaluate and treat men's mental illnesses and suicidality. And the Healthy Masculinities is a group of masculine identified people supported by the Sexual Violence Prevention and Response Office, SVPRO, and Health and Wellness situated on UBC's Okanagan campus that talks about issues that matter: social expectations, mental health, suicide, dating, consent, and sex. Now I'll let our panelists introduce themselves. And Rob, take it away.
Good evening, everyone. Thank you for allowing me to be here today. I'm hailing from Kelowna in BC, Canada, and I'm part of the Silks Okanagan Nation, is where UBC Okanagan sits and resides, where we acknowledge that learning has happened for thousands of years before the university has been established on that land. I come with over 15 years experience working in the post-secondary sector. I have a master's degree from the University of Toronto in higher education and a master's degree in counseling psychology, where I am currently now a registered clinical counselor working in the student wellness office. My work in the student wellness office provides one-on-one counseling and group work. And one of the groups that I run is the Healthy Masculinities group. We're currently in the 5th iteration of that group. We've been running it since 2019. And we've learned a lot about how our campus responds, interacts, and builds community around masculinity and its male population, male-identified population.
Thanks, Rob. Dave?
All right, thanks everyone for being here this evening and for having me on the panel. So my name is David Keeley. I'm an associate professor in the psychotherapy program in the Department of Psychiatry at the University of British Columbia in Vancouver on the unceded ancestral and traditional territory of the Musqueam people. And so I've been at UBC for a little while now. My primary role is as a researcher. I'm part of the RMS cluster, and my research interests include psychotherapy in terms of the process and outcome of psychotherapy. I have some men's mental health portfolio to my research as well, and I'm particularly interested in identity and personality vulnerabilities in mental health. And part of what I'm doing currently is a study on short-term online therapy for young adults who identify as having distress related to their identity. And so we're seeing a lot of young men in that program who are coming into the study with issues around their relationships and how they see themselves in relation to other people, and in particular, wanting to do some work on the kinds of relationships that they can have going forward. I also have a teaching and psychotherapy supervision role in my job. So I provide psychotherapy supervision to psychiatry residents and other graduate students. And I'm engaged in clinical work in my private practice, where I do see a lot of men, and a lot of men who are working on relationship issues. And so I'm really delighted to be part of this panel this evening, where I can, participate in some conversations about this.
Thank you. And Sarah?
Hi, everybody. Great to be on the panel today with Rob and Dave. So I'm coming to you from the sunny south. So I'm in New Zealand, and I'm a full-time senior research fellow at the University of Otago. So I have a background in public health, and I've been working in the field of suicide prevention and mental health research for over 10 years now. But my research interest in men's mental health really evolved during my PhD a few years ago, where I took a critical gender relations approach to exploring the linkages between masculinities and men's mental health and well-being in their everyday lives. And so I used a qualitative life history interview method to explore men's social relationships and their emotional practices, their work, and how they engaged in their own mental well-being. Not just in terms of distress, but just in everyday life in general. And then more recently, I've been doing a postdoc where I've been collecting stories about men's experiences of stigma in relation to mental illness. And I'm also currently working on a photo voice study with men, and I've just finished collecting stories and photographs which explore how men's experiences of anxiety and depression and suicidality are influenced by gender, and looking at the ways in which different things in men's lives help or hinder them through their mental health journeys. So I'm predominantly a researcher. I also do some PhD supervision, yeah, I'm pretty chuffed to be here today, so thanks.
Awesome. Thank you all for introducing yourselves. And we'll start our panel conversation first with masculinity and relationships. If you're just joining us now, I want to mention that we have a Q&A session after the panel questions. And so please hold your questions until then. And if you have something come up, you can put it in the chat and we'll make sure to address it. The first question I have is for all of you, and that is, what role does masculinity play in building and maintaining relationships among men?
I will leap in first. So I might just start off by saying that in most of my work, I use a masculinities lens, and it comes from the work of the sociologist Raymond Connell. And this is a lens that acknowledges the diversity amongst men and the diverse ways that they can do or perform masculinity. So when we're thinking about these plural masculinities, there's this one pattern that we often call hegemonic masculinity, and it's socially privileged and it's culturally dominant, and it creates this hierarchy of gender relations among men as well as between men and women. But what I really like about this lens is that it also acknowledges that men have agency, so they can pursue these dominant masculine ideas, but they can also be complicit in maintaining them, but they can also resist them, and they can reframe their masculinity. And this is something that has come up in my own work, and something that I'm particularly interested in relation to men's mental well-being. And in terms of relationships, I find this in my own PhD work. So I find that men often talked about their relationships. They sort of compartmentalized them. So they described having different kinds of relationships with men compared to women. So their relationships with men were often dominated by sports, physical activities, and doing things that we might call instrumental relationships. Whereas when they talked about their relationships with women, they often involved more open and personal communication. They often confided in women, whether it was female friends, female family members or partners, and it was what we'd probably call a more emotional relationships. And in terms of the question, in terms of masculinity, this pattern of relationships is a really good example of how men can build and maintain different kinds of social relationships, but they can still do it in a way that enables them to maintain a hegemonic pattern of masculinity in public. And so it doesn't affect their social standing amongst other men. But of course, one of the issues of this is it reinforces stereotypes, which I think Rob might talk about, the stereotype of men as problem solvers and doers, you know, who don't want to talk about their emotions rather than being listeners and talkers. And it also serves to make men's private endeavours to create deeper social relationships invisible from the public view. But I also found in some of the stories that I heard where men were actively resisting the confines of dominant masculinity. And so they were reaching out and they were building more supportive and meaningful relationships with other men. And these relationships were not confined to activity-based companionship. They were involving disclosure and sharing of their private and emotional lives. And I think what was interesting here for me is that for many of the men that were doing this, they'd often experienced some really significant and distressing events in their lives, such as serious illness or cancer, questioning their sexual identity. And it was these that tended to act as a catalyst for men's desire to build more deep and meaningful relationships with their male friends. And it's clear that this kind of, you know, these kind of friendships, relationships are not only beneficial in times of need, but also just in their everyday mental well-being. Yes, so that's my answer.
I'd love to follow that, Sarah, because in the group that I run, the Healthy Masculinities group, one of the first topics that I introduce is Connell's hierarchy. And we start to just discuss the idea of hegemonic masculinity and the idea of how the stereotypes and our culture and how that sort of perpetuates power over and privilege in many ways. And the topic right after that becomes intersectionality. And then we start to explore and trying to break down and trying to unlearn a little bit. But the reason why I love this idea as a starting ground is because a lot of the things that we talk about when we start saying, how did we learn? Who do we learn from? Who are our role models? We start to break down this idea of stoicism. And that, I think, has a big, big impact on how men form relationships in general. It tends to be a big relief right from week one when we start to look at that. So thank you, Sarah, for introducing that idea. I love that as well.
I think, Sarah, your answer was expansive, so I don't have too much to add to it. One point that does interest me is, and I see this a little bit more in the clinical sphere, because I'm not sure our research methods are very well attuned to this, and that is that men can, I've experienced this when men can consciously disavow this sort of hegemonic masculinity and take on a role that's almost opposite to that, or very, very, very much rejecting of that. But unconsciously, they often find themselves, they can still find themselves under the sway of this ideology, right? You know, so I mean, I'm thinking of a person who I've worked with who's very artistic and very emotionally expressive and values that a lot in his relationships with others. But he finds himself having these ideas about how he should be in relationship with other men or with women that he sort of wonders, where does that come from, right? Because it's not part of his conscious conceptualization of what it means to be masculine. It's something that runs deeper and comes from, I think, early learning, you know, along the lines of what Rob's alluding to there.
Thank you for the very insightful comments. on the roles of masculinity. I want to ask next, we talked about relationships and how masculinity factors in. What are the barriers that men face when building these relationships? And feel free to comment on both friendships and/or intimate relationships.
Yeah, so I might talk to friendships. So again, one of the things that I found in the stories of the men that I interviewed during my PhD was men who described wanting to have closer friendships with other men, friendships where they could confide, but they actually had experienced real difficulties in trying to do this. You know, for example, I had men tell me about instances where they were going through something really challenging and they wanted to disclose that to their friends. But when they did, they found their friends were unreceptive, or their friends felt really uncomfortable with the way that the conversation was going. Or sometimes the conversation was just simply shut down and they were blocked from saying any more. And I think this is really interesting because what it points to is that some men are willing to resist these ideas of self-sufficiency and emotional suppression, and they want to attempt to build, you know, stronger and deeper relationships with other men, but it clearly comes with risks. And so for quite a few of the men I spoke to, you know, they did talk about that sense of shame and embarrassment, and they felt judged for going against either the norm of what men should be doing. And I think the problem with this is that it then puts men off from trying again. And it reinforces that belief that actually it's just safer either to not confide in anyone, or in some cases to rely on women for building those relationships that are more intimate and more focused around emotional exposure. And so, yeah, men are fearful of breaking those unwritten rules and those boundaries of male friendships.
I think to extend that into the romantic relationship sphere, I would echo what you're saying there, Sarah. I think that those kinds of beliefs or ideas also interfere with men being more fully themselves, if you will, when they're entering a relationship with a romantic partner. They're often, in my experience, they're often under the influence of these ideas about how men ought to behave when they're with a partner, what's acceptable, what's prohibited, what's going to happen if they do this, if they do that. And a lot of that does have to do with sharing one's emotions, one's emotional experience, one's vulnerability. I've heard men talk about how they worry that that's just going to be the death knell to a relationship. They're getting close to a romantic partner, and if they should speak of anything about their emotional vulnerability, they worry that the other person will see them as weak, that they'll need to be looked after, and that they won't be seen as reliable. And so there are those kinds of ideas about how a man ought to behave in a partner type relationship. I think there are individual differences that come into play here as well. And so for some men, the emphasis might be a little bit more on a belief around what the other person will do, how their partner will respond to them. And for others, the belief may be more around their own personal code, if you will, like how they see themselves and how it will affect their self-image. But so there can be variations on how masculinities can influence men's building of relationships.
I would echo that exactly, David. And we see that in the group now, the last 2 iterations of group, without my intervention, this idea of how men can show emotion in their intimate relationship to their female intimate partner. And there's this dichotomy where there's, on one hand, we see their partner asking, please be more emotional. Please tell me what you're thinking. Please share with me. And then on the other hand, there's the men who are saying, well, when I do, you shut me down. So there's this weird, like, they don't know what to do. And it's been a discussion for about a year now that I've seen in the group. And it's interesting. I don't have the answers necessarily, but I love to see the conversation.
Yeah, and I might add to your point, Rob, in terms of men expressing their emotions, I had a few stories where men talked about how their emotions weren't just policed by other men, but they were policed by women as well, not only in their friendships, but in their relationships. So I remember this one young guy telling me how he used to love to watch rom-coms. He loved how they made him feel, and he wanted to openly cry when he watched some of them. And he did it for the first time with his new girlfriend. And she was just shocked. And the way that she reacted to his display of emotion was really, really traumatizing for him and damaging for him, because she was telling him, yeah, I'm your girlfriend, but I don't really want to see you crying. And so I think it's really important to remember that, it's both men and women that have a role to play in these relationship building.
Thank you for touching on the complexities of both vulnerability and the stigma that exists. To connect that, we know that transitioning out of an intimate relationship can have detrimental effects on men's mental well-being. What are some ways that men can cope with these breakup transitions?
I think one way would be to prepare for the feelings that are going to come, right? I think, and to normalize them, right? That when there's a separation, when there's an ending of a relationship, that a sense of loss, a sense of grief is expectable. It's normal. It doesn't have to mean anything other than there's been a separation or an ending. So, I mean, I think if we can get that out into the culture a little bit more, that would be a good thing. Similarly, with feelings of sadness and anger, to see these as acceptable, I think that would be a great way for us as a society to be able to help men transition out of intimate relationships. I think also, and this is where individual, differences on account of individual circumstances comes into play. But some men may overly accept responsibility for the ending. They may see it as their fault. And so there may be misattributions around, like, what's the cause of the breakdown and the breakup, and that can be problematic. And on the flip side, some men may completely externalize any responsibility for the breakdown. And so there are extremes there. And I think social support, if social support is kind of reliable and clear-eyed, that's a great way for men to get a clearer sense of what happened here. I've seen some men who've suffered from what I would call traumatic relational breakdowns, where they feel overly responsible for what happened, and they keep beating themselves up and blaming themselves and engaging in this sort of self-punitive inner turmoil, and it's really a terrible thing. So those are a few ideas off the top of my head.
I'd like to add that in the context that I'm working with post-secondary students, oftentimes the relationships are shorter. They're a term or a year or maybe a couple of years. They're not long. They're not marriages. They're not divorces. But what I want to offer is that they can absolutely be detrimental to someone's self-esteem, someone's self-image, someone's ego. There's a great amount of grief and loss that's experienced in a relationship. I've seen it multiple times, both in group and in private practice, one-on-one. And what I want to offer is, if we have this stereotypical North American Western culture that says I'm not even allowed to be sad or cry or suffer. How am I supposed to display these emotions that I don't know? I don't even know where to go for help. Who do I talk to about this? So I encourage a lot of support seeking, a lot of normalizing, a lot of conversation from trusted individuals that the person can turn to. And then I also encourage a lot of sort of identity work, like goal setting and maybe some distraction techniques and things like that, but trying to encourage this student that, or whoever, that they are more than their relationship.
They're both really great answers. I don't think I have much more to add, but it did make me think of a participant who I interviewed who used the term emotional fortressing. And he talked about how, you know, that was the most appropriate way for him to cope. And that is how he had always done it like that. And that's how he would continue to do that. And he actually saw it as a strength. That he could control the expression of his own internal emotions, but that he could also prevent others from, you know, knowing how he's feeling and how distressed he was. So yeah, I mean, I'm not a clinician, but I do think we need to be finding ways to, you know, encourage men to move away from that idea that fortressing is a healthy thing, because, you know, for many of the guys that I've spoken to, it's not particularly helpful in the context of their everyday mental health or in the context of relationships breaking down.
I think that's such an elegant. Can you hear me now? Okay. Seems like the UBC Wi-Fi was just a bit glitchy. But just, yeah, moving on to the next question. We will touch on seeking support and this idea, but along the lines of relationships, how has help giving, in other words, helping a friend who is going through a rough time, how has this factored into men's experiences of mental health?
You mean like how is it helpful for a guy to help another person going through a difficult time?
Yeah.
Well, I think there's something, I mean, I think there's something beneficial for all of us to be able to exercise our altruistic muscles, if you will, right? So, you know, we all have the capacity to be altruistic and helpful. And so there's something just fundamentally, I think, positive about that. I think if you were looking at the positive psychology literature, there'd be a lot in there around that. But I think, you know, from my perspective, I think that there's something more that can happen there. And that's that if a man is helping out somebody else who's going through a difficulty, he can identify with them, and he can put himself in their shoes and identify with their plight, and maybe learn from that and see that, you know, it's okay. You know, like, I don't think less of my friend for the problems that he's having. Maybe I can feel okay if I myself have similar difficulties and vulnerabilities. And so going forward, it might be, you know, a little bit easier for him to be able to open up and be a little bit more vulnerable, and maybe challenge some of those, you know, more traditional masculine ideologies.
Yeah, I might just pick up on you know, Dave's point about having similar vulnerabilities. So interestingly, in the interviewing that I've done, help giving hasn't really been something that's come up much, but there is something that's come up around having shared experiences. So those guys that have experienced something really significant, I'm thinking of a young guy I spoke to who was diagnosed with leukemia in his 20s. And he had this sort of unsolicited encounter with this older guy who had also been through a cancer journey for many, many years. And they struck up this really strong friendship. And he felt that this guy had really helped him. But he also said that then he had learned the value of that positive influence of this friend who's reached out and helped, or the guy that became the friend reached out and helped. And by learning that that was a really beneficial thing to do, he started to do it more in his own friendships. So there's something there, I guess, about having a shared experience, but also once you experience what that's like, perhaps it's easier to do it yourself.
This idea of men supporting men is a big through line in the Healthy Masculinities group. And I think that it's something that we don't see enough of. I think at the most in our modern day culture, we get like, oh, that sucks, man. And then they move on to whatever. How's that game kind of talk. So I think that, yeah, if we can encourage curiosity and more questions and support, that would be really good.
Yeah. And as the world continues to transition away from stricter COVID restrictions, what is your advice to guys who are anxious and uncertain about how their relationships will look post-COVID?
I guess, don't get so, try not to be too used to the COVID restrictions, right? I mean, I think we've all formed habits around that over the past couple of years that we need to kind of break out of a little bit. So my advice would be to nudge yourself forward, as things open up. But like maybe at a deeper level, I guess what I would encourage people to do is to try to find ways of being reflective on your own emotions, your own experiences, your own thoughts and feelings. And, that may seem like I'm suggesting you should engage in some sort of navel gazing or self-focus or something. But in a way, if we can be attuned to our own feelings and what's going on for us, I think that probably makes us a little bit better equipped at engaging in relationships and dealing with any of the anxieties that come up when you are getting close to somebody, or when there's some kind of rupture or conflict that occurs in a relationship, because you've been practicing those skills, to be able to reflect on yourself. There's a term for that, mentalizing or reflective functioning, and a little bit of the work that you've done shows that it's associated with resilience among men and with the initiative to keep growing as a person and to achieve your goals. So I think engaging in self-reflection and practicing that would be a good thing to do as things open up.
Yeah, I would add to that also, in terms of thinking about friendships or your social networks. I read a piece of research recently where the researchers found that a key impact of lockdown on friendships was what they called relationship funneling. And this is a process where, some of your friendships were prioritized and they were even strengthened during this time, through increased contact and communication, albeit, from a distance, while others just fizzled out. And so I guess that's the funneling, right? So I guess I would advise guys to think about and reflect, like Dave was saying, has this happened in your own social networks, you know, are there people that you just haven't heard from for a long time, you know, and have those friendships fizzled out? Or are they actually friendships that you want to rekindle and rebuild in some way, and, you know, perhaps reflect on how you might go about doing that? But I think also acknowledging that there's going to be a sense of loss and a sense of grieving for our friendships because they have changed. And I think acknowledging that, you know, everybody's been really stressed. Some people have experienced significant loss, and just reminding yourself that, you know, as much as you've been stressed by it, so have they. So yeah, reflection, I think, is a good point, really.
One of the topics that comes up a lot is this idea of feeling out of practice. This idea that I don't know how to make a new friend. I haven't made a friend in 3 years. And this idea that most of my community is online. It's video game community. So those are some of the trends that I'm seeing, and we need to build confidence in being able to go back out there and say hi. I think that's a really great little thing.
Yeah, thank you all for those insights. Now transitioning into service provision, talking about professional services. What encourages guys to try out services, and what keeps them engaged? And you can draw from your personal experience as practitioners, or just from the research that you're conducting and reading.
So in my experience, guys feel more comfortable coming for help if they know somebody else who's sought help before and it's gone well for them, and they think to themselves, okay, I'll give that a try. It's not, you know, the taboo's being broken. It's not something that there has to be a big stigma about. I think there is still a big stigma out there for guys to get professional help, especially psychotherapy. I hear about it a lot. Whether people are feeling that stigma sort of socially, or whether it's just internalized, I think both carry a lot of weight for men, and they can be barriers. What keeps them engaged is if they meet a practitioner who I think can be flexible, who can help them feel safe. But what I mean by that is that safety looks different for different people, and safe may not be what the therapist has in mind. You know, what might make a female client feel safe isn't necessarily what's going to make a male client feel safe, and what makes one man feel safe who aligns with particular masculine values may look very different for a man who aligns with different masculine values. So I think if the practitioner can be flexible enough and get a reading on that, and then modulate themselves in response to the man and where he's at to facilitate safety for him, I think that can be a great way to help men feel, you know, like this is okay, this is useful. Obviously, if the therapist says something that's intelligent and that's meaningful and that's personally relevant to the client, that demonstrates that they understand, that they have a thorough sense of where he's at, that the therapist gets him. I think those are factors that can definitely help a man feel more engaged and to stay engaged in the process.
I think I agree with word of mouth. I think that's definitely a good referral system, as well as I find most people on campus are looking for trust and relationship building. So they're in it for something, but they're also looking to meet a deeper need, and I think that's powerful.
Yeah, in the work that I've done, for those guys that have tried services for the first time, it's quite often been through workplace employee assistance programs. And I think that is reflective of our mental health system here in New Zealand. We don't have a lot of publicly funded services for the sort of mild to moderate end of things. And so here we have these employee assistance programs which offer free and confidential access to at least 3 sessions with a clinical psychologist or a counsellor. And I think it feels a safe way to try it out because firstly, they're not having to pay for it. So, you know, if it's not a good experience, they don't feel like they've had to fork out a lot of money. Secondly, it's only 3 sessions. So if they don't like this person after 3 sessions, they don't have to see this person again. But in saying that, therapists can extend to another 3 sessions at their own discretion. And I think the other thing is that because they are encouraged and they are improved by employers, men can go during work hours or their lunch hour, and it can be done quite anonymously. So it's, you know, it's a good way to try it out. In terms of staying engaged, I think cost is an issue. And I've recently spoken to some young men who have had ongoing participation in treatment that has been government funded through sensitive claims for childhood trauma. And under this arrangement, they've been able to get up to a year of treatment fully funded. And for them, it's the time, it's the having no financial or time pressure that has maintained their engagement because they haven't felt rushed to get through everything in the first few sessions. They've had a therapist who has spent an extensive amount of time with them trying to understand and make sense of their past trauma. And it's been done in such a sensitive way that they've wanted to keep going. And the guys that I've spoken really highly of the treatment that they've received through this route.
Yeah. And with that, I know we've touched a bit about the flexibility that a practitioner should have, but what else are the challenges that men face in building therapeutic relationships with these healthcare professionals?
I would say the challenges are often on the side of the healthcare professionals rather than challenges that are sort of inherent in men. I mean, it's our job as professionals to try to be effective for everybody, right? I mean, that's what we ought to be doing, and that has to be our primary objective. I think challenges often come up when clinicians feel like they have to fit to a particular model of practicing, that they have this idea, this is what we should be doing in the counseling relationship, or this is what the intervention ought to look like. And then if a guy comes in and he's not there, that's not his way of working, it's not going to go well. And then it's going to be a therapy failure that's going to be demoralizing for him. Some men can overcome that and seek further services, but for some men, you know, they won't try again, right? And that's the tragic part, right? So that's where I think we need to enable clinicians to be more attuned and flexible, and not to be overly adherent to a particular model that they have in mind of what counseling or therapy ought to look like. You know, we know from the broader psychotherapy research literature that after trial after trial after trial, there is no evidence that any one approach is superior to any other, right? So you can't really reliably make the claim that, for example, CBT is better than interpersonal therapy or vice versa or anything. The evidence suggests all of these approaches are roughly equivalently effective. What matters more is the therapist and the quality of the therapist and the therapist's ability to facilitate a good relationship with the client. And so I think that's where the action is, and that's true for men. And I think we just have to get better at enabling providers to be tuned in and to be flexible.
I agree. My point was going to be about pace. And I think that we need to follow along at the client's readiness. And sometimes that can be very slow. Sometimes they're ready to dive in like after 5 seconds, and that's okay. But it's about matching and being ready and following the client a little bit. And I think with men, there is a little bit of stigma. Again, I want to bring that up because we want to normalize like what counseling is and what it can be, and trying to sort of allow the client to get what they need from it. Wanting to, sometimes I encourage like a well-placed joke can be very powerful. I encourage a lot of authenticity. It's just about that rapport.
Yeah, I think those are both really great answers, and I don't have much to add. I guess just thinking about some of the men that I've spoken to who have had experience of those therapeutic relationships, and for them, there's often been this deep sense of shame or of embarrassment being asked to talk about their emotional lives by health professionals. And I guess that's broadly tied into building trust and rapport, with a health professional. But, there's certainly that being able to talk about your emotions in that setting, I think is something that, really comes to the forefront. And it's, I'm not a clinician, but I guess that is an area that clinicians need to consider, particularly when they're treating men.
Yeah, I think just to follow up on that, I think in my experience, I think a lot of men might come, especially men who do adhere to traditional masculine ideology, they might come to therapy walking a bit of a tightrope, where on the one hand, they worry that the therapist is going to make them sort of, outpour all of this emotional vulnerability, and that's just not going to work for them, right? But on the other hand, I think at some level, they're hoping that the therapist isn't going to make them feel like they need to adhere to traditional masculine ideology, right? So they want to sort of be able to have an experience where they can gradually question it or challenge, work with it in their own way with a therapist who can kind of respect where they're at and not push them and not make them feel bad for adhering to these traditional masculine ideas, but at the same time not make the man feel like he's painted into a corner and has to uphold them, right? So I think that they're often looking for that kind of flexibility from the therapist.
I think that's a great answer, Dave.
Mm-hmm. I agree. And what types of these programs or interventions or supports do you think are needed to better support young men to build and sustain strong and healthy relationships? Or what do these programs need to focus on even?
Well, the program we're doing is a little bit unique because we're individually tailoring the intervention to the person, right? Now, it's not a male specific program, but we do have a lot of young men coming into it. And so what we try to do is the therapist is tasked with, in the first session or two, developing a thorough formulation of who this person is, what are their past traumas, what are their goals, what are they wanting to work on, what might be getting in their way. And then we think about, okay, what will this person need going forward? What are they going to need in terms of the therapist's attitude toward them? What kinds of interventions are likely to be helpful for them in achieving their goals and overcoming their obstacles? So from my perspective, I think, I'm biased toward individualized, personalized interventions rather than, saying something more general that, like all programs ought to do this, that, or the other at that. From my perspective, I think the more personalized we can get, the better.
our program, UBC Okanagan, was inspired by this idea of addressing rape culture and making it a men's issue and trying to pull apart some of that culture. And that's how it started. That was the inspiration. And we had a great director leader who was motivated in creating this program. And it's evolved. And so we started to pull it apart and we started to look at what are the components of this, and it's culture and stigma and colonialism and power and privilege and so many things. And ultimately trying to create conversation, create room and space to unlearn. And that's why the program evolves a little bit every time. We do sort of have a template. We sort of have ideas and pillars that we want to hit, but the content, the material, the activities change slightly every time we run it.
I might just do a plug here for a recent paper done by the cluster by John and co, looking at men's relationship programs. And it's a really interesting paper because it highlights how a lot of these programs are downstream in nature. Quite often third-party referrals for domestic violence and intimate partner violence. But what this paper really highlights is the lack of tailored upstream interventions for supporting men to build and sustain strong and healthy relationships. And myself, as someone who's not involved in programs, I am more at the upstream mental health promotion end of thinking. I spent a lot of time in my PhD thinking about how we might tailor upstream promotion strategies that take a really critical masculinities lens. So what might a social marketing campaign look like that supports men to critically consider their mental health in the social context from a gender perspective? How might we have a campaign that encourages men to engage with and draw on the multiplicity and potential for change within masculinities? How could a social marketing campaign promote social and emotional connections among men and appeal to ways of being a man that are beneficial for mental well-being? How could we show young men that their masculinity doesn't need to be defined by suppressing particular emotions, that their social relationships don't need to be defined by non-disclosure, and that men can be listeners and talkers, and that it's a myth that men don't have these relationships. So it's a big question, and sorry, I don't have any answers, but it's something that I've often wondered about from a sort of upstream perspective.
I think that's a wonderful answer to the question. Very interesting to bring up the upstream and downstream supports and services around men's mental health. And this next question is for Rob and Dave as counselors. What are the benefits and disadvantages of providing online services to men building better relationships during the COVID-19 pandemic, or just the online services that will continue to be used?
I mean, the main benefit is access. I mean, I think more men can access the service now, right? Because there are less barriers in terms of driving into the office. They can dial in from the workplace, from home at the end of the day. It's just so much more flexible. It's incredible what it's done. I think a disadvantage is that I know with some men who've reached out to me and who I've been working with, they would really like to meet in person. They really want to feel connected, to just be physically in the same space and to be connected in that way. And I think that is a shortcoming of the online service. So it's difficult to overcome that in a virtual setting, but there it is. I do think that's a disadvantage.
When the group was originally created in 2019, we only had 4 sessions that were IRL because it became COVID in March. But we set this precedent of halfway through the group, I ordered food and it was delivered and it came to the classroom, and we sort of did family style, long table, buffet kind of situation. And that was so powerful to sort of break from this psycho-ed to this dinner table where we could sort of informally carry on the conversation. And then it was really hard to sort of bring the people back to the chairs and back to the PowerPoint. So that piece was missed, I want to say, and when we transitioned online. But the online allowed us to keep going. Like without being online, we wouldn't have been able to keep the group running at all. And in some ways, with COVID, and we're all coping at such a high level, it was easy to be able to sort of just log in at home with a minute to spare, sort of in your pajamas or whatever, and participate in this dialogue. And it was the community that kept the group going, that component, that relationship piece, regardless of being in real life or virtual, we were able to foster that. And that was surprising and powerful, that I was pleased with.
Thank you, Robin and Dave. And for Sarah, from your work on the mental health of men in New Zealand, in what ways have men's relationships featured in your research? I think you're muted.
Sorry, I'm the first one, right? Do I get a prize? Yes, I've already talked a bit about particularly my doctoral work really drew on men's social relationships. But I'm currently undertaking a project, which is a photo voice study, where we've asked men to take pictures of what has helped or hindered them in moving through or past their experiences with anxiety, depression, or suicidality. And we've collected numerous stories and pictures, and they include things like men's hobbies, men's daily rituals, precious things, important people, favorite and significant places. And in terms of relationships, there has been a lot of photographs of friends, family members and partners. And I'm at the analysis stage, but I can give you a couple of examples. For example, one guy included this picture of he and his male friends hiking or tramping, as we say in New Zealand, tramping up in the mountains, and they're walking along a really narrow trek. And so his picture is off the back of their heads. And he talked to me about how this was the best place where they would go, these three friends, to really talk about stuff. They would talk about their relationships and their girlfriends. They would talk about their work and the things that were bothering them. And it's really interesting that he said that this is the place where we could do this, as opposed to sitting in the pub and having a drink and doing it. So it's a really good example of also how place can influence men's relationships. And I've had other young men who've experienced trauma in their lives, and often include pictures of their mothers or sisters who have been there for them during these tough times. And also a number of guys that have included pictures of nieces and nephews, and they talk about the hope and the joy that their interactions with these young people bring them when they're in really dark places. So there's a lot of photographs that we need to work through, but there's certainly a lot of stuff in there around relationships and how they can help men when they're moving through challenging times.
Yeah, thank you. It's really interesting to hear about place and how that is associated with mental health and conversations. Being mindful of time, we'll enter the Q&A session soon, but for the last question, Rob, I would like to ask you, what are the most common mental health impacts of distressed relationships among male university students?
Yeah. Again, That's a big question. I don't have the data necessarily, but I would love to say anecdotally that I think a lot of it comes down to this ideas around confusion, identity, low self-esteem, isolation, guilt, shame, loneliness, depressive symptoms, suicide ideation, increased substance misuse, all kinds of maladaptive coping, I would say, is something that I'd really want to keep an eye on, and encouraging healthier patterns, if that makes sense.
Yeah, it's helpful. And now it's 6:32, so we'll we'll open the floor for questions. I think we'll start with the questions that have been dropped in the chat, and after we address some of those, you can feel free to unmute your mic or use your chat and submit more questions. And so the first question that we had earlier is from Caroline. What would you like to see happen in the faith community to provide and promote support and ensure men can feel comfortable to be included in workshops, classes, etc.?
I think that might be a tricky question. I don't have the answer, but I guess I would liken it to here in New Zealand, when we talk about Indigenous and Maori mental health and designing interventions and programs, we often use the phrase by Maori for Maori. And that is where we're acknowledging that those who are in the community are often the best placed to be designing and delivering those programs or interventions. It's just sometimes the case they don't have the resources to do so, and so need, you know, others' help to do that. But we also have this saying in New Zealand, you know, if we sort health issues for Maori, we'll sort them for all. So it is about focusing on the group that you're looking at and who is best placed to be working with that group or that community.
Thank you. We have another question from John. How could we differentiate men's emotions and vulnerability?
I think it's important that I stress this in the group that, or with everyone, that men are entitled to feel the full range of the emotion wheel. And we have to create space for that display. And sometimes it can be uncomfortable for both the male to display and also for the people around him to receive. And I think that is the vulnerability piece, is that it's not the emotion, it's the, are we okay with this culturally?
Yeah, good old curly question from John, eh? It's a tricky one, right? I mean, I guess when I first heard that question, I thought, well, what do we mean by vulnerability? And I guess there are different ways of being vulnerable that are not necessarily all about the emotionality. You know, we look at someone who, for example, might be homeless, and the vulnerabilities around being homeless, you know, versus the emotional lives of the homeless, you know, are, you know, it's all in there, but there's obviously a way to unpack what we mean by vulnerability.
Yeah, we can move on to the next question from Paul. Have any approaches emerged in your work with men to help facilitate peer social connection / interactions online?
Again, anecdotally, I can say that I'm told, and maybe people are lying to me, I don't know, that coming to the group online is a highlight of their week. They try not to miss it. They look forward to it. They get a lot out of it. And I think that's because of their opportunity to share, to listen, to reflect. So I would encourage those things, as well as encouraging members of the group to connect amongst themselves. And we see that a lot where they're making plans, they're sharing their social media accounts, they're sharing their phone numbers and their Discords and all those things. And they make plans. They go out for a drink. They go out for a sport. And I love that they're making community outside of the group. Not necessarily because of the group, but because they met each other through the group.
Yeah, thanks. We have another question from Caroline. It's a long question, but I think I'll boil it down to the essence, which is how can we best reduce stigma or make men feel welcome? And if there are workshops or classes, and should we be targeting men only or doing it as a community?
My vote would be as a community. I think through a forum like this one, and you know, it's conceivable there could be all kinds of iterations of different sorts of public forum opportunities, social media, just getting the word out, you know, around help seeking, destigmatizing. I think we've got a public relations mission here to just keep getting the word out and to be relentless about it. I mean, we're pushing back against a really big wave, and so it's just going to take a lot to keep getting the word out. I think the efforts that have been talked about so far, the work Rob's doing, for example, I think that's wonderful. We just need to keep it up.
There is some literature there's some research in the mental health literature that looks at peer support groups for service users, so mental health care service users. And there was a paper a few years ago looking at men's experiences of being part of these peer support groups. And their feedback was very constructive. And it wasn't necessarily about being amongst other men, it was about being amongst those who had similar mental illness experiences. And I think there's a lot of literature out there around the value of formal peer support, certainly attached to mental health services.
Thanks for your answers. And we have another question from John. How can we help men to reconcile discordant emotions, in other words, anger and sadness, when a relationship breaks down?
Sorry, no, you go, Dave.
Okay. I think, as I said before, I think keeping the conversation going. I think talking about them, norming them, making it explicit that, you know, this is part of being human, that you're going to have relationships that correspond to events in your life, right? And an event like a relationship breakdown is a significant event. I think there are multiple ways of doing that. And I think it depends on the individual man and what his style is, and, you know, like what helps him feel safe. And so for some men, I find myself just speaking very matter-of-factly about it, and almost just a very educational approach. With other men, I might lightly tease them. I might just say, well, what do you expect is going to happen? You know, you have a breakup, right? You know, like, you're not supposed to feel anything. And you know, like, we can get playful about it, and that can be a way going forward. For some men, they benefit more from some self-disclosure on the part of the provider. Hey, been there, done that, you know, and sort of go along those lines. So I think it depends on the individual and the nature of the relationship that's facilitated between the two of them. To add to it, though, like, just to take it a little step further, is that I would be watchful for secondary emotional responses like shame or guilt, right? And to be thinking about, you know, like, we would expect sadness, or we might expect anger in the form of frustration. This was a relationship that one really had their hopes up for, and now that's come to an end. There's going to be some grieving that has to happen, or some expression of anger. But I would be watchful for the emergence of secondary emotions like shame or guilt that suggests something where the man is attributing responsibility to himself, maybe punishing himself, and maybe there are some inaccurate or inappropriate attributions there that we would want to tease out a little bit more and help to process.
One of the things I often try to do is reflect, oh, that you were angry, you were emotional, you did this, and they're like, yeah, I just told you that. And then I say, well, tell me why. And what I'm trying to do with that is really trying to have them challenge their belief systems around sadness and anger and grief and so on, and where do those feelings come from, and why are you suppressing, and why is it bad to show? So we want to sort of unpack that a little bit, and then normalize, and then offer healthy coping strategies towards you should express that, but like, what are some better ways? If that makes sense, sorry.
Yeah, I totally agree with what Rob's saying, and it's something that came out from my PhD research. By using a life history interviewing technique, I asked guys to go right back to childhood and talk about when they were growing up as young boys, and the kind of messaging that they received around gender and around masculinity. You know, and many of them recalled a time in their life where it was no longer okay to cry, and it was no longer okay to be distressed or to be sad. You know, and a number of guys that talked about, you know, almost bullying by older brothers, or even messages from parents about, you know, don't be a sissy. You know, that's a girly way to be. You know, come on, boys, don't cry. You know, and these messages start so young. And, you know, as adults, you know, are we really cognizant about where that messaging first came from? And a lot of the guys that I spoke to, you know, would say to me, wow, I've never really thought about that. But yeah, my dad was this, and yeah, my brothers were this. And, you know, they start to become really aware of how emotions were done in their families when they were growing up. You know, and perhaps being able to understand that and make sense, like Rob is saying, of where that comes from, could be really helpful.
Yeah, thank you. And another question from Mike. Are there any upstream interventions that men can use to be more prepared for relationship breakdowns as opposed to dealing with it after the fact?
I think that's a really great question, and I think that is what this paper that's been published by the cluster is pointing to, is that there aren't really a lot of upstream interventions for helping grow and build strong and healthy relationships. So, I mean, I'm not aware of any. I'll let Rob and Dave answer if they are.
No, I think there's a lack. I think Sarah's right there. There's a lack in that area, but it's conceivable that you could do a lot with interventions like that. I mean, I think there's a real opportunity there for some great preventative work to be done.
I know that my colleagues on campus are, and a little bit in the group that I run, we talk about components of healthy relationships and being proactive in being a part of designing your relationship. Yeah, so anyways, the work that we do on campus, there's a lot of work being done around healthy relationships. But I feel like that's very grassroots and very dependent on the group that runs that week kind of thing. But yeah, that's definitely something that we emphasize on campus, is this idea of supporting and nurturing the growth of, and if necessary, the breakdown of relationships in a healthy way.
We have another question here from Angela. How can self-reflection be built on men to think thoroughly instead of reacting emotionally or by feeling?
Well, it's easier said than done, right? I mean, to say just be more reflective doesn't quite cut it. I think there are different strategies. I think mindfulness practices can be one way to go. I don't think that's the only route towards self-reflection. I think if culturally and societally we get better at norming self-reflection as a practice and sort of promote its benefits, I think that's helpful. I think, and this is where it gets to be a little bit of a sort of virtuous circle, if you will, that good relationships promote good self-reflection, and then good self-reflection promotes good relationships. So I think I sort of coming at this from a provider or clinician perspective, if as clinicians and providers, we can be good at providing good, safe, secure, responsive relationships to men who are seeking our services, I think that is one way in which self-reflection can emerge and flourish.
Something that I know that is a personal bias for me is this idea of mindful self-compassion, and I plug that a lot in the work that I do. It's something that I encourage in my one-on-one and in group work. And I really think that this is an area where men can grow in trying to be more self-compassionate, and therefore having more self-awareness and being less reactive to their emotions.
Yeah, both great answers. I don't have anything else to add on that.
Yeah. And if anyone wants to ask their questions by unmuting their mic, feel free to raise your hand or just go ahead and unmute. Otherwise, I'll be monitoring the chat for more questions as we near the end of our event. Here's a question from Caroline. Is there anything we can be doing to help education or educate parents on watching for and being more aware and open to discussing signs of possible mental illness with male children to start allowing them to be okay with emotions at an early age?
Well, I think if programs can help parents reflect on their own parenting practices and reflect on themselves as parents, and to understand, just to help parents get a little bit more of a sense of why I do what I do. I mean, I think a lot of parents have the experience where they say words come out from their mouth and then they say, oh my God, I sound just like my mother, or something like that. I think if we can help people like pause when that happens and think about it, and also look for opportunities to examine what are the biases that I have about being a parent, and where do they come from? How much is masculinity or femininity, for that matter, influencing how I am as a parent with my kids, and the kinds of values that I'm implicitly passing on to them, and the kind of atmosphere that I'm creating with them. So, I mean, I think, this is sort of, again, from a kind of intervention perspective, if we were working with parents around that, that would be one way in which we can help parents reflect on their own practices, and then be a little bit sensitive to reactions that their child is having, where maybe the child is indicating that, this particular atmosphere is not really working for me, and helping parents be a bit flexible in modulating their responses.
I totally agree, Dave. Like the common idea of like, daddy's little girl or mommy's little boy, those kinds of things need to be, broken down. And why are we able to treat both children the same? Or do we coddle our daughter when she skins her knee and tell the boy to walk it off? Those kinds of things, right? And the other thing is creating more language around emotions early, and reflecting, using those words back, saying like, do you feel this? Do you feel this? Oftentimes when children are little, they don't have the words, and they just say like, my tummy hurts, when they're depressed, or when they're sad, or when they're guilty, or all kinds of stuff. So we have to be aware of that.
I think masculinities can be expressed as loyalties in a way, like it's a loyalty to the way in which a man was raised growing up, a loyalty to the code, if you will. And I think that can be passed along through parenting as well, where parents can almost unconsciously feel they're being disloyal if they do something different, if they're stepping outside the lines. And so that can create some tension. And I think helping people feel freer, I think that's part of what people do when they see a therapist or come to group therapy or work with peer support, is in a way they're looking for alternatives, and they're looking for permission from others to seek alternatives and to go outside the lines, and maybe, if you will, transgress some of those loyalties that may not be working so well for them.
Yeah, I would just add just an answer to that question. As a fairly new parent myself, with a very lively 2-year-old boy, I'm very aware of how we deal with emotions in our household. My partner tells me I often give him pep talks about it. Of course, once you're a researcher, you're always a researcher, right? But there are actually a lot of good books out there written now for preschoolers that help them to identify emotions and to have some of the words that they need. So they're not just hurt, or it's not just ouchy. There's more to it than that. And it's the whole range of emotions. So we've got this great book about, I can't remember the title, but what I feel when I'm angry, or what I feel when I'm sad. And I think there is an increase in children's books for parents. So, I mean, I would encourage Angela, who asked the question, to, Google, do an Amazon Google, and there are some good books out there, particularly for preschoolers, for parents to read to them, obviously, including dads.
We have another question related to books as well. Is there any particular information or books that you would recommend in building emotional foundations for someone that hosts men's groups for emotional support and peer bonding, or any techniques or practices?
I don't know of any books, but I think if you were to do a good old Google search with the right keywords, you'd probably be surprised at what's being written around men and their emotions. And I think there's increasing awareness that we need to be talking about it more openly, and acknowledging, this code that, Dave was talking about. and how we support men to challenge that code. So I think if you are searching in the right directions with the right keywords, that you might find some stuff online. I'm not aware of any books in particular that I could recommend.
In terms of techniques and practices, it's not male specific, but I would refer you to some of the literature on mentalization in psychotherapy, mentalization-based treatment. This was originally designed for the treatment of patients with severe personality disorders, but it's been broadened from there with the recognition that reflection is generally a healthy thing to do. And so this literature is kind of cueing professionals in to how they might promote that in their work rather than shutting it down. I think some helping practices could inadvertently shut down people's exploration and reflection. And so these would be techniques that are helping to open that up a little bit more and promote that in either an individual or a group setting.
There are many resources that I've collected along the way, but when we were starting, the works of Jackson Katz were instrumental and sort of foundational for us.
Yeah, I think we'll take one last question from the chat from Haneen. First, they thanked us. And I was wondering if there is any interesting literature or research that explores concepts of masculinity in transgender men.
That's a great topic that I am currently trying to dig into as well. I don't have specifics right now, but I love that you brought that up. Thank you so much.
There is definitely academics and researchers who work in this field, and who draw on masculinities and queer theory and intersectionality. So the literature is out there, and there are researchers who are interested in this particular area. I would imagine it probably sits in the academic literature currently, but I'm sure it exists.
Awesome. Well, mindful of time, we're coming up to 7 p.m. So I want to thank the three of you panelists very much for your time and for sharing all of your insights. And thank all of you for attending today. Yeah, if you have any other questions on how to reach us, feel free to put that in the comments or in the chat, and we'll stick around for a bit longer. Thanks, everyone.